we're here at ESMO with Professor Heinemann. They just presented the results of CLGB and FIRE3 studies here in the session for metastatic colorectal cancer. Professor Heinemann, thank you for being with us. What are your conclusions from those two studies?
My conclusion is that, first of all, we have really provided very mature data, I think, for the FIRE3 study. We could perform RAS testing in more than 80% of the patients, and also we did an independent review of the CT scans in 83% of the patients. And for that reason, I think we are quite comfortable to have reached a very solid database at the moment. So the main message, I think, from the FIRE3 trial presently would be that still the primary endpoint was not met, that was response rate, but the overall survival showed now a difference of 8.1 months, indicating that patients receiving cetuximab did really better than those patients receiving bevacizumab. The independent review where we could analyze the CT scans of CT evaluable patients indicated a significantly greater response rate, 72% versus 56%. That shows a 16% difference in response rate, also favoring now the cetuximab arm. We also looked at early tumor shrinkage and could show that patients with a tumor load decrease of equal or more than 20% were by 20% more frequent in the cetuximab arm compared to the bevacizumab arm. And finally, we also looked at depth of response, and we could show that patients receiving cetuximab had a median depth of response of 49% as compared to 32% in the bevacizumab arm. If you just look at these two different rates, you will understand that by research they would qualify as PRs, so they would be qualifying very similar. Now, the different depth of response was highly statistically significant related to the overall survival. So we believe that specifically with an anti-EGFR agent, depth of response can be developed as a valuable surrogate endpoint for overall survival.
Professor Sobrero commented that it may be too early to conclude about CLGB study. What do you think about that?
I absolutely agree with that. I think in the podium it became quite clear that probably the similarities between the CLGB and the FIRE3 are greater than the disparities. And I think we have to understand that the patients receiving cetuximab first line are quite similar in the FIRE3 and in the CLGB trial. Now, the big question is, why did the patients receiving specifically FOLFOX plus bevacizumab do so well in the CLGB trial? At the moment, we don't understand that. But we have to understand also that the CLGB came to the podium with an interim analysis, with an ongoing analysis. So we have no final data here. And I think we are very well advised to wait until they have solid data, and then we are extremely willing to go into discussions with Alan Venug and with Heinz-Josef Lenz, and in fact we already planned these kind of interactions to compare the trials.
Okay, thank you very much, Professor Heinemann.
Thank you.